A disturbing and frightening situation has been unfolding at long-term care and retirement homes ever since the very start of this pandemic. Tonight, we have gathered a list of homes with the latest COVID-19 numbers, and they paint a stark picture. At least 112 homes are currently grappling with outbreaks, including Altamont Care Community here in Scarborough, where there have been 17 deaths, including a personal support worker this week. Nearly half of Ontario's COVID-19 deaths have been linked to long-term care facilities. The severity of the outbreaks in these homes has been likened to being in a war zone with no protection.
It's like they're in a war with bullets coming at them and they don't know where they're coming from.
By our count, at least 27 homes have reported one or more deaths.
It is like wildfire. What's happening in long-term care right now is shocking.
The homes are scattered across the province, with some of the highest fatality rates in the GTA. Seven Oaks in Scarborough with 23 deaths, Markhaven Home for Seniors in Markham with 13, Eatonville Care Centre in Etobicoke with 32. SEIU, the union representing 25,000 healthcare workers, has called on the province to take over operations at Eatonville and two other long-term facilities in Ontario, but the government rejected the request.
Every province has got the legal obligation to keep their workers safe. Nobody should go to work and die at work and not return to their families. This is what's happening in these nursing homes.
This week, one of her members died after contracting the virus at work. Christine Mandagarian died less than 24 hours after testing positive. She was a personal support worker for 31 years at Altamont Care Community in Scarborough. Her family devastated by her loss, writing she was a kind, funny, and giving person. They've started a GoFundMe campaign to raise money to purchase personal protective equipment for the home where she worked, writing they don't want their mother's death to be in vain. We don't want another family to go through this.
I am extremely angered over that. I will stand up for her and fight for her now and long after this, because I really believe her death could have been avoided.
Infectious disease experts say they have been preparing for institutional outbreaks like this since SARS and every flu season since, and more should have been done sooner to protect these vulnerable communities.
If we weren't prepared because we had no idea, that's one thing, but we knew perfectly well what was coming, and yet we do nothing with long-term care homes.
The province has launched an action plan for long-term care homes, including making sure that personal protective equipment is delivered to every home in need, as well as putting in place more aggressive screening measures and making sure staff cannot work at more than one of these homes at a time. For City News, I'm Yazdani.